The first theory of how this actually works, it's based on neurology.
So here are the cutaneous nerves of the head and neck, and this right here shows the trigeminal nerve. So here's the ophthalmic division, the maxillary division, and the mandibular division. And we're going to look specifically at the ophthalmic division. And what you'll notice here is that there are areas right there on the temple, and then there's actually right here from the maxillary division, right there, that goes to behind the temple where we're placing that product. And look here at the mandibular division of the trigeminal nerve and how it feeds sensory information into the temple. So this is the anatomy we're working with, and then here you can see in the colors it shows where the superficial areas are.
Now, according to the Association of Migraine Disorders, the cranial nerve number 5, or the trigeminal nerve, is almost always associated with migraine headaches. The second hypothesis as to why this might be working is vascular. So let's go back to the anatomy textbook and understand what we're talking about.
So this picture right here shows the arteries that go through, and these are branches of the temporal artery and vein, and you can see how they go right across the temple and they intertwine with the ophthalmic arteries right here, and they really come from in front of the ear. You've got the red, which are the blood vessels of the arteries, and the blue are the veins right across in front of the ear, above the cheekbone, and behind the eye, where we would put that product.
Now, what's interesting about vasodilation and migraine headaches, or headaches of any nature in this area, is that over-the-counter medication very often uses caffeine as one of their ingredients. So if you get an over-the-counter medication and it has, let's say acetaminophen as well as caffeine, very often it's the caffeine that might be affecting the migraine the most. Because what does caffeine do to blood vessels? It vasoconstricts, which means it narrows the blood vessel. It stops that swelling or the bulging of the blood vessel. Now, the advantage of that is it does get rid of your pain. The disadvantage of that is it can raise your blood pressure. So if people have eye trouble, kidney trouble, or blood pressure trouble, you don't want to be raising your blood pressure. So one of the side effects is significant. So one of the advantages of using a natural approach that does not involve over-the-counter medications or prescription drugs is simply that we're not harming the eyes, the kidneys, we're not harming your blood pressure. And if it relieves pressure on those arteries, whether it takes tension off the artery or takes pressure off the artery, just relieves strain off the artery, if it relieves pain and it works, why not do that first? The third and final hypothesis that I have in regard to how this works has been fascia and muscle. Now, again, let's go back to the textbook so I can show you what I mean.
Right here is the temporalis muscle, and overlying that temporalis muscle, they cut it away right here. You can see along this path, and you'll see it says there, the temporalis fascia. And that is the covering of that muscle. This muscle connects down into the jaw, as you can see right here in this picture, and controls jaw movement. So it eccentrically loads when you're opening the jaw, and it concentrically contracts when you close your jaw.
Fascia and muscle are probably one of the most overlooked causes of physical pain in our body, particularly in regard to peripheral nerves. And the fascia is that stuff between the skin and the muscle tissue, and it's intertwined. And very often, this is where I find that cupping, dermal traction cupping with movement, particularly over scar tissue, will have tremendous benefit for patients. And there's lots of different ways to deal with fascia. There's Graston technique, there's deep tissue techniques, there's active release motion techniques that you can use with your hands. But this is a very simple thing, cupping that is, or anything that tractions the skin off the underlying tissue, can help people tremendously. So when it comes to the headaches, you think, well, there's the temporalis, that's connected to the TMJ. The TMJ is a source of tremendous pain when it comes to migraines and headaches and various things like that. So if you take the stress off the fascia and the muscle of the temporalis area, or the temporalis muscle or fascia over the temporalis, that could be a reason why this works so well in relieving headache pain.